Hi, my name is Olivia Flores, and I am a current second-year Master of Athletic Training um, student here at Manchester University. Today I will be talking to you about culture-bound syndrome. The culture-bound syndrome I chose was Ataque de Nervios. Ataque de Nervios is an idiom of distress principally reported among Latinos from the Caribbean, but recognized among many Latin American and Latin Mediterranean groups. Ataque de nervios can be easily mistaken as panic attacks because the descriptions of ataque de nervios may align with the Diagnostic Statistical Manual description for panic attacks. But the correlation of most ataques with a specific triggering event and the common absence of typical symptoms like acute fear or apprehension set them apart from a panic disorder. Individuals with ataque de nervios may feel a sense of being out of control of their body, which is usually triggered by a traumatic event or receiving terrible news about a loved one. For example, the news of the death of a close relative, or separation or divorce from a spouse. The culture of origin and history of ataque de nervios is that it is commonly found in Puerto Rico and the Dominican Republic. It is also observed in Latin American and Mediterranean and Caribbean cultures. Ataque de nervios has been studied for more than 50 years, and it stands as one of the most studied cultural concepts of distress. Its initial documentation in American mental health literature dates back to the 1950s when U.S. military psychiatrists stationed in Puerto Rico first reported it. Some signs and symptoms of ataque de nervios are tremors, epileptic episodes, palpitations, uncontrollable screaming, crying, feeling of heat rising from chest to head, suffocation, loss of control, distemper, distress, cold sweat, blurred vision, aggressive or suicidal behavior, dissociative episodes, hysteria, and auditory hallucinations. As for clinicians fostering a cultural humility and respect in patient care, for clinicians wanting to do this, wanting to foster cultural humility, and demonstrate respect in patient care, it is important to educate yourself and gain awareness of what ataque de nervios is, as well as its cultural context and its causes. It is also essential to understand the cultural beliefs and experiences surrounding ataques de nervios for providing respectful and effective care. Having open communication and listening to patients discuss their experiences with ataque de nervios, so that they feel safe and heard when expressing their concerns is also very important. And then ensuring effective communication by using interpreters when language barriers exist is also essential for building trust between the clinician and the patient. And then respecting cultural beliefs when providing patient care is also very important and should be done so that the patients feel heard and seen and don't feel like they're just being dismissed. And here are my references. Thank you for listening.